There are sometimes hereditary components to developing arthritis. So we see with aging, we mostly see the type of arthritis such as osteoarthritis, which again is that mechanical degenerative wear and tear arthritis that we see. The wear and tear, the repeated micro traumas on the joints over time will not only degrade the joints, they'll degrade the cartilage. There are also supporting structures within the joints, tendons, ligaments, other soft tissue structures that can get injured over the course of repetitive micro trauma. It's also important to notice that with the aging process, the quality of those supporting structures in the joint also deteriorate. One of the biggest examples of that is I see somebody, an older patient, come in with shoulder pain and they just had a fall, or they just lifted up something heavy and they can barely lift their shoulder up any longer. Well, that's because over time and the repetitive micro traumas that occurred on their tendons may have injured their rotator cuff to a certain point where it was almost that straw that broke the camel's back. They did this one activity that they've done maybe 1,000, maybe 1,000,000 times in their life, but it was this time that actually caused a large tear. Aging is potentially the largest factor, those patients developing joint discomfort and arthritis in particular. We're having a large aging population because of the great therapeutics that we have for many other conditions. Up until now, people were living into their late 70s, and we're seeing people live well into their 80s and 90s nowadays. And so that aging population will have a larger arthritic disease burden moving forward. And it's going to be important to take care of yourself when you're younger to be able to prevent that in the future.